You slip your shoes on first thing in the morning and they fit perfectly, comfortable, no issues at all. But by afternoon they're painfully tight, digging into your ankles, and you're quietly wondering what changed in just a few hours. If this sounds familiar, you're far from alone. This exact scenario plays out for millions of people over 60, day after day, and most simply chalk it up to being on their feet too much, or standing around at the grocery store all afternoon long instead. But what if there's actually more to this story than a long day and a pair of shoes that suddenly feel smaller than they did that morning? Let's be clear about something important. Some swelling really is just a normal part of getting older, and gravity, standing, and everyday wear all play a role in it. But here's the tension worth sitting with. Persistent swelling, the kind that shows up day after day and never fully goes away overnight, shouldn't automatically get dismissed as just aging. That assumption is exactly what lets genuinely treatable problems quietly go unnoticed for far too long, sometimes for years at a stretch. Here's your first real clue. Timing. When exactly does the swelling show up? Swelling that appears in the afternoon or evening, after you've been up and moving around, often points to something quite different than swelling that's already there the moment you wake up. Morning swelling that hasn't resolved overnight can actually be a more meaningful signal, since gravity had all night to work in your favor and it still didn't fully go down. Nighttime swelling adds yet another piece to this puzzle worth paying attention to. Fix number 1 is simpler than you'd think. Walk before you sit and keep your ankles moving throughout the day. Here's why this actually works. Your leg muscles act like a natural pump, squeezing the veins in your calves every time you take a step, helping push blood and fluid back up toward your heart. Sit still for hours and that pump essentially shuts off, letting fluid quietly pool in your feet and ankles instead. Even a short walk around the house or simple ankle circles and calf raises while you're seated can reactivate that circulation and make a genuine difference by the end of the day. This isn't about intense exercise, it's about not letting your body stay motionless for too long at a stretch, especially after meals. Let's pause for a second. Think honestly about your day. How many hours are you actually sitting, back to back, without getting up? Watching TV, reading, sitting at the table long after a meal is done. Be honest with yourself here. If that number surprised you even a little, you've just found one of the simplest places to start making a real change. Fix number 2 is elevation, but there's a right way to do it. The basic principle is simple. Raise your legs above the level of your heart, letting gravity help pull fluid back toward your core instead of pooling in your feet. This works best after periods of prolonged standing or sitting, especially in the evening when swelling tends to peak. Lying down and propping your legs on a couple of pillows for 15 to 20 minutes can genuinely help. It's not something you need to do constantly throughout the day, but building it into your evening routine, particularly if you've noticed swelling worsening by nightfall, can make a real visible difference by the following morning. Take a look at your ankles right after you pull your socks off tonight. See that deep indentation left behind, the ring pressed into your skin that takes a while to fade? That's not just a cosmetic quirk of tight socks. It's actually a clue. Doctors call this pitting, and the depth and duration of that mark can say something real about fluid retention happening beneath your skin. It's such a simple thing to notice, and yet most people never think twice about what it might actually mean. Fix number 3 is about attacking hidden sodium. And no, this isn't about eliminating salt entirely. That's neither realistic nor necessary for most people. It's about noticing where the sodium is actually hiding. Canned soups, deli meats, frozen dinners, and restaurant food often carry far more sodium than anything you'd add with a shaker at home. A few realistic swaps make a real difference. Choose fresh or low-sodium canned vegetables instead of regular canned, swap deli meat for freshly cooked chicken or turkey a few times a week. And season with herbs, garlic, or lemon instead of reaching for the salt automatically. These small, sustainable swaps genuinely add up over weeks, without making mealtime feel like a punishment. Some of the biggest sodium offenders don't even taste especially salty, which is exactly what makes them so easy to overlook. Processed meats like bacon, sausage, and ham are loaded with it. Canned foods, even the vegetables, often carry hidden sodium as a preservative. Sauces, dressings, and marinades sneak in far more than you'd expect. Packaged, ready-to-eat meals are frequently among the worst offenders of all. And restaurant food, however fresh it looks on the plate, is almost always seasoned far more heavily than anything you'd make at home yourself. Quick question for you. Which of these is your most common weak spot? Deli sandwiches, canned soup, restaurant meals, or something else entirely? Drop it in the comments, no judgment here, we've all got one. Fix number 4 might genuinely surprise you. Stop fearfully cutting back on water. So many people assume drinking less means less fluid retention, but that logic can actually backfire. When your body senses dehydration, it tends to hold on to whatever fluid it has even more tightly, which can worsen swelling rather than improve it. Staying properly hydrated actually helps your kidneys function the way they're supposed to, flushing out excess sodium and fluid more efficiently. This isn't a license to drink excessively, especially if you've been told to limit fluids for a specific reason. But for most people, staying hydrated is genuinely part of the solution, not the problem. Fix number 5 is one people rarely think to check: your medication cabinet. Certain blood pressure medications, particularly calcium channel blockers, along with some NSAIDs, steroids, and diabetes medications, can contribute to fluid retention as a genuine side effect. If your swelling started or worsened around the same time you began a new prescription, that timing is worth mentioning to your doctor. But here's the critical part. Never stop a prescribed medication on your own, even if you suspect it's connected to your swelling. That decision belongs with your doctor, who can review your full medication list and determine whether an adjustment makes sense or whether the swelling has a different cause entirely worth investigating. Here's the single most important self-check in this entire video, so pay close attention. Look down at both of your feet right now. Are they equally swollen, or is one noticeably worse than the other? Swelling in both feet, roughly equal on each side, often points to something systemic: circulation, medication, or how your body is handling fluid overall. But swelling in just one foot or leg is a different story entirely, and it deserves prompt attention since it can signal something localized, like a blood clot, that shouldn't wait. Here's when these simple fixes stop being enough and you genuinely need to take the next step. If your swelling is persistent, worsening despite trying everything we've covered, unexplained by anything obvious in your routine or unusual in some way, asymmetric, painful, accompanied by shortness of breath or skin changes, that's your signal to see a doctor for a proper evaluation. Lifestyle habits genuinely help many people, but they're not a substitute for identifying an underlying cause when one is actually present and needs treatment. Let's count down the red flags that mean don't wait, seek care immediately. Sudden swelling that appears out of nowhere, especially in just one leg. Redness or warmth around the swollen area. Severe pain that feels disproportionate to what you'd expect. Chest pain alongside swelling, and any difficulty breathing at all. Any one of these on its own is reason enough to seek emergency evaluation right away. This isn't the moment for home remedies or waiting to see if things improve overnight on their own. Let's make this simple with a 5-fix challenge you can actually remember. 1. Walk more, sit less. 2. Elevate your legs in the evening, above heart level. 3. Cut back on hidden sodium, not water. 4. Stay properly hydrated instead of restricting fluids out of fear. And 5. Review your medications with your doctor if the timing lines up. You don't need to master all 5 overnight. Pick one to start this week and build from there. Small, consistent changes genuinely add up more than people expect. Here's something important to leave you with. If your feet keep swelling even after trying all 5 of these changes, there's one thing you genuinely shouldn't keep treating at home on your own. Persistent swelling that doesn't respond to lifestyle changes is your body's way of asking for a real answer, not another home remedy. That answer comes from a proper medical evaluation, not from another video. Before you go, drop a comment with your age, your country, and whether your swelling affects one foot or both. It genuinely helps me understand who's watching and what to cover next, so don't be shy.